Assalamu alaikum class, this is your course in charge Hirafsha, and today I am here with the new topic that is bones and its classification. And today I am going to demonstrate you about the different structures of the bone and its classification and for our anatomy lab demonstration, first year morning and evening batch. Now I am going to start my topic with the introduction of the bones. And the bones are rigid organs, and they are made up of the supportive connective tissues. And bones protect the various organs of the body. And bones helps to store the minerals, and it provides structure and support to the body, and it also helps in the movement of the body and enables the mobility of the body. So bones are the supportive connective tissues, and they provide the protection, and they provide the structure to the body, as I have already discussed it in the specialized connective tissues, and today I am going to discuss it in further details. And bones are of variety of shapes and sizes, and they have complex internal and external structures. So the human skeleton of an adult consists of around 206 to 208 bones. And when the child is born, at the time of the birth, he or she has 270 bones. But later on, their bones decreases in number to 80 bones in the axial skeleton and 126 bones in the appendicular skeleton. I will further explain you about the axial and the appendicular skeletons in my further slides. Now comes to the classification of bones. Bones are classified on the basis of their shapes into 5 categories. Number 1 is the long bone, short bone, flat bone, irregular bone, and the sesamoid bone. Here you can see the flat bones of the skull or the cranium. These are known as the flat bones. And then the irregular bones of the vertebrae, and these are the long bones of the thigh or lower limb, that is known as femur. And this is the short bone of the wrist or carpal. And this is the sesamoid bone, which is present between the knee joint, and that bone is known as patella. So this is the diagrammatic presentation of the different types of bones, which I am going to discuss further in my another slides. Now comes to the long bones. Long bones have a shaft and the diaphysis, and that is much longer than its width. And these long bones are longer in shape than its, and they have short width, and an epiphysis, which is a rounded head, which is present at each end of the shaft. The long bones are found in the arms bones such as the humerus, ulna, and radius, and the legs, leg bones such as the femur, tibia, and fibula. The functions of the long bones are that they act as levers, and they help in the movement when the muscles contract. Here you can see the diagrammatic presentation of the long bone. This is the diaphysis. Diaphysis is the main or midsection shaft, here you can see, of the long bone. And the epiphysis is the rounded end of the long bone at its joint with adjacent bone, and this portion is known as epiphysis. Here you can see the epiphysis, this portion. And then the metaphysis is the narrow portion of a long bone between the epiphysis and the diaphysis. So this is the diagrammatic presentation of the long bone. It has three parts: epiphysis, metaphysis, and then the diaphysis. Now comes to the short bones. Short bones are roughly cube-shaped structures, and they have approximately equal size length, equal size width and thickness. And they have only a thin layer of compact bone surrounding a spongy tissue or interior. And the only short bone in the human skeleton are the carpal bones of the wrist and the tarsal bones of the ankles. So the functions of the short bones are they provide stability and they provide support, and they provide limited mobility to the body. So here is again the diagrammatic presentation of the types of bones. Here you can see it: the flat bone, skull bone, short bone, and the long bones of the lower limb or the upper limb, and the sesamoid bone between the joints or the patella, and this is the irregular bone of the vertebrae. Short bones of the tarsals. Now flat bones. Flat bones are thin and they are generally curved, and they have two parallel layers of compact bones which are sandwiched between a layer of spongy bone. And the examples include the cranial bones and the scapula, which is also known as the shoulder blades, and the sternum, which is also known as the breastbone, and the ribs. The functions of the flat bones are they provide point of attachment for the muscles, and they also protect the internal organs. Here is the flat bone of the scapula or the shoulder blades, and the cranial bones or the skull bones, and the sternum or the chest bone or the breastbone, and these are the ribs and the hip bone. Now comes to the irregular bones. Irregular bone is one that does not have any definite shape, or therefore they does not fit into any other classification. So they consist of thin layers of compact bone surrounding a spongy interior, and these bones tend to have a more complex shapes like the vertebrae, and that support the spinal cord, and it provides protection from the external forces. And the bones of the spine, pelvis, and some bones of the skull are also the irregular bones. Examples include the ethmoid bone and the sphenoid bone. What is the ethmoid bone? Ethmoid bone is an unpaired bone in the skull that separates the nasal cavity from the brain. And the sphenoid bone is an unpaired bone of the neurocranium, and it is situated in the middle of the skull towards the front. Here you can see the ethmoid bone. Ethmoid bone, which separates the nasal cavity from the brain, and the sphenoid bone. Sphenoid bone is situated in the middle of the skull towards the front. Here. And the other colored parts are the regions of the brain, frontal lobes of the brain, frontal lobe, temporal lobe, parietal lobe, occipital lobe, and I will further discuss these lobes in my presentation of the brain. Now comes to the sesamoid bone. The sesamoid bone is a small and round bone, and as its name suggests, it is of same shape like the sesame seed, and the sesamoid bones are embedded in the tendons. Tendons are the sheaths of the tissue that connects the bones to the muscles. The sesamoid bones protect the tendons by helping them to protect from the external forces or the compressive forces. Examples include the patella, which is found in between the knee joints, and the pisiform. The patella is also known as the kneecap, or it is a flat circular triangular bone, and it articulates with the femur or the thigh bone, and it covers and protects the anterior surface of the knee joint. And the pisiform bone is P-shaped bone, and it is a small bone, and it is a type of the sesamoid bone that is found in the wrist. Here you can see the diagrammatic presentation of the sesamoid bone. Now comes to the regional classification of bones. On the basis of the regions, the bones are classified into two: axial skeleton and the appendicular skeleton. The axial skeleton is the part of the skeleton that consists of the skull bones, facial bones, thoracic cage, and the vertebral column. And the appendicular skeleton is the portion of the skeleton of vertebrae that consist of the bones that support the appendages. And the appendicular skeleton includes the bones of the shoulder girdle and the upper limbs, the pelvic girdle, and the lower limbs. So this is the axial skeleton, which consists of the skull bones, laryngeal skeleton, and the thoracic cage and the vertebral column. Here you can see the skull, vertebral column, thoracic cage, and the laryngeal skeleton. Now I'm going to discuss the axial skeleton in detail. The axial skeleton consists of the cranium, and cranium is also known as brain box or the brain case because it encloses the brain. So it consists of 8 bones. Here you can see the 1 frontal bone and 2 parietal bones, 2 temporal bones, 1 occipital bone, 1 sphenoid bone, and 1 ethmoid bone. So these are the 8 bones of the cranial bones. So these are the 8 cranial bones which compose the whole cranium or the brain box, which encloses the brain. Now comes to the facial bones. There are 14 bones in the face, and that makes the whole face of an adult. And these include these 14 facial bones include the 2 maxilla or upper jaw. Here you can see the yellow part, and 1 mandible. Here you can see the purple part, and 1 palate bone. Sorry, 2 palate bones. This red part. 2 zygomatic bones. This green part. 2 lacrimal bones. This sky blue part. 2 nasal bones. This pink part. 2 inferior concha bones or concha, this parrot green part, 2 inferior concha bones, and 1 vomer, this dark blue part, 1 vomer. So these are the 14 facial bones which made up the whole face. Now comes to the thoracic cage of the axial skeleton. The skeleton of the thorax is made up of the sternum and the 12 pair of ribs and the 12 thoracic vertebrae. Sternum is also known as the breastbone, which you can see over here, and this is the 12 pair of ribs, and this is the 12 thoracic vertebrae. Now comes to the bones of the thorax. Number 1 is the sternum, which is also known as the breastbone, and it is the flat bone which is divided into 3 parts, namely the manubrium sterni, body of sternum, and the xiphoid bone. Here you can see the manubrium sterni, body of sternum, and this is the xiphoid bone. So this is so these are the 3 bones which makes the sternum of the thoracic cage. Now comes to the ribs. Ribs are arranged in 12 pairs, and on the back side all of them are attached to the thoracic vertebrae. So depending on their attachment in the front, they are classified into three categories: true ribs, false ribs, and the floating ribs. The true ribs are upper 5 pairs of ribs, and they are attached to the sternum directly. And the false ribs are lower 5 pairs of ribs that are attached with the sternum indirectly through the costal cartilages. And the floating ribs are the lowest 2 pairs that are not attached in the front. Now third part of the thoracic cage is the vertebral column, which is composed of the number of bones, or these are 33 in number, and these bones are known as the vertebrae. Here you all can see the true ribs which are attached to the sternum directly, 1 to 7, and then 8 to 12, 5 pairs that are attached to the sternum indirectly through this costal cartilage, purple part. Costal cartilages, and these are the 11 and 12 number or 2 pair of the floating ribs that are not attached to the sternum. Here you can see the first thoracic vertebra, and this is the sternum, xiphoid process, costal cartilage is here, and then the 12th pair of rib, and then the 12th thoracic vertebrae and first lumbar vertebrae. So this is the diagrammatic presentation of the thoracic cage. Now comes to the classification of the vertebrae. On the basis of the regions, it is classified into 5 categories. The 3 categories are known as pre-sacral vertebrae. There are 24 pre-sacral vertebrae, which is further classified into 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae. Here you can see the the diagrammatic presentation of the 7 cervical vertebrae, 12 are the thoracic vertebrae, and 5 are the lumbar vertebrae. Then the third region or the fourth region is known as sacrum, which composed of the 5 fused sacral vertebrae. And the last regional classification is coccyx. Coccyx consists of 4 frequently fused coccygeal vertebrae. Here is the lateral side of the spinal cord, and this is the posterior view of the spinal cord. You can see the 5 regions: cervical region, thoracic region, and lumbar region. This region together known as presacral vertebrae. These are total 24 in number. And then comes to the sacrum. Sacrum consists of the 5 sacral vertebrae, and then the coccyx, which composed of the 4 fused coccygeal vertebrae. So this is all about the axial skeleton. I will further explain you the appendicular skeleton in my next part of the presentation. Thank you.